The environment has
What we're saying is have a heart.
We've got to be able to regenerate our
There'll
economy.
be people who are kind, people who are cruel, but that's life. You can be passionate about videos. I'm fine with that.
Let's say in the field of plastic surgery, have there been any procedures or any substances that were used that turned out subsequently to be harmful, like substances for breast implants and all that?
History is littered with substances. Silicone oil is the prime culprit, and that's been used in Asia for nearly 50-60 years. Medical grade silicone oil or even low grade silicone oil has been used to plump up breasts, faces, lips, and there was a craze in the late 60s and 70s because of course there wasn't so much surgery going on, but there was a ready availability of these injections, so people were doing it to beautify themselves, and 10 years later they all became hideous as the silicone hardened, formed infective lumps, or just spread beyond the areas that they had originally been injected.
In Latin America, there are a lot of people who go to unqualified practitioners who put in silicone or other substances into the butt just to make them perky.
And when you inject something permanent into the body reacts to it, tries to get rid of it, or tries to wall it off so that it doesn't irritate the body anymore. And in trying to wall it off, it creates these multiple hard fibrous lumps.
The point is that silicone is not as inert as it was believed to be. So it does stimulate an inflammatory response from the body's tissues, and that then leads to all the problems.
Okay. There have been some high-profile cases where liposuction has come into play and the patients have died. There was a 44-year-old mother of 2 who collapsed in the clinic after a procedure to remove fat from her abdomen. Why do these things happen? Is it because the doctors are unqualified? Is it just the normal course of events in any medical treatment? You would also have cases.
Let me qualify first by saying that complications can happen to any surgeon. My problem with some of the cases that you've mentioned are because they've been performed on by physicians who I think have gone beyond their area of training.
Liposuction, is that a surgical procedure?
Liposuction is a very complicated surgical procedure. There are lots of things going on. There are body shifts, there's fluid shifts, blood shifts as the procedure is going on. And as you said, if you're careless, you can hit a lot of vital structures. You could hit an intestine, a liver, a spleen, a lung, or even a major blood vessel.
What has the ministry done about this? Has there been greater controls on liposuction?
And I think that the regulations, the standards that the regulations require for being officially allowed to perform liposuction are far too low. And that's why the barrier to entry, if you like to call it that, is extremely low. And I think that is the reason why we are seeing so many problems.
You don't do any?
I don't do liposuction.
Why don't you do it? You're allowed to.
Technically under the rules, yes.
So what prevents you from doing it?
I would think that liposuction has its risks, and also there are a lot of people who are competent to do it. So let the ones who have the long histories of training do it. Yeah.
And you think surgeons are more trained to do
Plastic
such things?
surgeons.
Okay,
Plastic
let's put it this way, Kenneth.
You're not being elitist, both of you.
No,
We're just saying that the more training you have, the better equipped you will be to produce higher quality work and to have a lower incidence of problems.
So you're
with
not happy with the
patients.
current regulation because you think it's too lax? You think it should be tightened?
I think it should, and I think it's really a basic...
Has any presentations been made to the ministry?
Yes,
many.
many.
I've written to the press many times.
And what has been the response?
We have noted your letter, thank you.
Allow me to speak a word of
Yes,
fairness. I think the modern liposuction, if I'm not wrong, was invented by a obstetric gynae surgeon.
You're wrong. I'm sorry, but you are wrong.
Who
It was
invented?
invented by a plastic
Staying out of this,
surgeon
man.
called Illus.
Okay.
Okay.
Probably there's some controversy
And,
from
and I
other-
know where you got that from. You get it from an internet site because these renegade physicians around the world create websites which are heavily subscribed to or viewed, and the information is not entirely accurate. So we are in plastic surgery. We know the history of plastic surgery. We've studied it. We've
Okay,
seen
but
the
wait, let Bernie
personalities.
continue his story.
But let's say for a general surgeon, a gynae surgeon who has also many years of surgical experience, not being certified to do liposuction, don't you think that is a bit mean on that part?
I think they shouldn't be doing it either, actually.
Not at all.
Not
Because-
gynaes as well.
because we're
Although they're surgeons, they
Yes.
qualify.
They
But
have
you see-
surgical training, but they don't have a training in doing liposuction.
Yes, but then the regulations would say they can
Yes,
do it.
that's because the regulations allow it. But it doesn't mean to say that the regulation is correct.
Okay, so we are adopting a high standard. And if you think we're wrong, then fine, you're entitled to that viewpoint. And I think if the country as a whole, if the public, if the health authorities think that a lower standard is acceptable for the country and for the people of the country, then so be it.
But it's lower by your judgment, right? But then obviously the ministry doesn't think that it is a lower.
That's right. So that's where there's a disagreement.
If you're talking about licensing, it should be uniform, that it should be standardized. People should be going through the same kind of training system to equip themselves with doing not only liposuction but other plastic surgery procedures as well.
Listening to what has been said,
Horror stories.
would you feel that you would still go for liposuction with an experienced aesthetic physician?
I
And you've read the newspaper
in
reports.
the first place, if I want to go under the knife,
You don't need it.
I don't need it. Not yet.
Not yet.
anyway, yeah. But if I were to go under the knife, I would actually look for a plastic surgeon more than a general surgeon. It feels safer.
No, if it is where surgery is involved, but if it is non-surgical,
Non-surgical.
yeah, like what Bernie is doing, Dr. Liu is doing.
Then there's
Then you would do your homework.
yes. Then you have to do your research and you've got to
Because
ask
they're
around.
doctors, remember, they've spent a good number of years being trained as doctors. They've also been trained to do the aesthetic aspects of the treatment that they go through, you know.
And we accept that. We don't have any beef with doctors doing the non-surgical component of aesthetic medicine.